like a lifetime ago to me.
That's right.
It does.
All right, then I would,
I move to accept the minutes.
okay, second,
Second.
all those in favor? Aye,
Aye.
it's approved. All right, public comment. I don't think we have any members of the public here.
You do have Elaine Baird here, so she is a member of the public. So if you
Oh,
wanted to, this would be a
correct.
time to check in with Elaine.
Here's David. He's just coming in.
FinCon.
great. All right. Very good. Did you have any comments or?
No, I'm just here as a liaison from FinCon,
All right.
From where?
Finance Committee.
Finance Committee, yeah, good. All right, moving along, the chair's report. I think I just want to say on behalf of the board and myself, what a fabulous job Judy and your staff have done during this episode. And I want that to go into the record as our support and our thanks. Thank you. Financial report.
May I suggest we take a vote on that?
Sure.
So moved. So moved.
So moved.
Was that Keith and Sandy?
Yes.
Second.
So
Okay.
when you vote, just so that Donna can record it, just make sure you like nod yes or nod yo, because if everybody says yes or no at the same time, she needs to be able to.
Raise your hand. Raise your hand,
There you
maybe.
go.
I
Or
don't know.
yes? Resounding yes.
Yes.
Everybody say yes? Or six
Yes.
yeses? Thank you. 7.
Okay. Financial report. Judy.
Okay, so that was in the packet that was sent out. So this is for the month of May. It's not a fiscal year-end report, but it is a good indication of where we are. For our town appropriation accounts, which are on the top of the report, but I'll say the numbers out loud since we're live right now. Right now, our FY20 budget is $712,192. The remaining available funds we have for salaries is $51,684.22. And the remaining funds for expenses is $18,618.48. So we have about 10% of our budget for the final month of June. We're in good shape. I mean, that's right where we should be. We've been watching the numbers very closely. We did turn back 10% of our funds to the town and because of the revenue shortfalls this year because of the COVID shutdown. And we still are going to be fine, within these limits, mostly because we turned back funds that like through day center or mild winter, we weren't going to use. So there wasn't really a significant impact to us in doing that. And it helped.
Can I ask a question?
Mm-hmm.
Or should I wait?
Why don't I finish the financial report, Sandy, and then you can ask,
Okay.
anybody can ask financial questions. All of the other accounts are revolving accounts. And what that means is that at the end of the fiscal year, the ending balance will turn over to be the starting balance of the next fiscal year, which is FY21. A lot of our formula grant monies, they are all being used. What happened with formula grant, I will tell you, is that we weren't able to spend it as we had initially anticipated because of the shutdown. A lot of things were canceled. We have been meeting with the State Executive Office of Elder Affairs weekly. They encouraged us to submit a revised budget and gave us indications of the things that we could spend it on. For instance, we had several employees that don't have cameras on their computer screens, so we purchased new screens. We did the technology purchases. We got a phone and we got an iPad for outreach so that we could start doing more remote work. In addition to that, we've used the funds for some printing, and we will use all of that money. Which is very important because if we don't use the state formula grant funds, they lower next year's allocation. So we are, however, anticipating a decrease in the formula grant funding for next year. We've been told to expect that because of the revenue shortfalls in the state budget. We have gotten, I will let you know, we did receive a very generous grant or gift towards the cost of emergency food. We got a $10,000 grant, and you'll see that in the budget at the, it came in May, and you'll see that on the financial report. We have a plan in place to start using that. 100% of that will go to the cost of food for seniors. That will not support anything else but food costs. That should get us through the next 6 months. We will continue to offer the meal program, and I'll report on that later. So financially, we're all set. Our expenditures from those revolving funds is a little bit lower than normal, simply because although the COA is open, the building is closed and we don't have our normal activities. So that is the financial report.
One question.
Yep.
So you're forecasting for the coming year,
Mhm.
and what percentage is it down?
What percent is the budget down? Are you talking
Yes.
about the state formula grant?
No, this is COA budget.
Well, we cut 10% of what was left in our operating expenditure budget in March, and we turned those funds back to the town. I'm right now at town meeting, the budget that we had requested for FY21 that all of you approved back maybe January was funded. So we're all set there. Now, I don't know what will happen as the town really looks at revenue projections over the course of the summer. But right now we're all set.
Okay, that's what I wanted to make sure of.
Judy,
Okay.
can I ask a question?
Yeah,
Sure.
Bob?
Where did that $10,000 grant come from?
So the donor wishes to remain anonymous, but it is somebody who's local here in our community. And they use the Cape Cod Foundation as their fiduciary intermediary. So that's where the money came from. And we call it the Fund for Elderly at the Cape Cod Foundation, which is what they've asked us to use. I do know who it was. I have been asked to keep that information confidential.
Thank you, Judy.
And I will say the person actually reached out to me. It wasn't a solicited gift. I mean, it was somebody who really quite generously stepped forward and just wanted to do something and wanted to know what would be of the most help. And one of the things that we have found very quickly is that food became, just such a major issue. So.
How is that used, Judy?
So what it will be, it's going to fund, so we have been delivering the meals on Mondays and Fridays, and we've used the Nauset school system to do that, beginning right after July 4th. So on July 6th, we are bringing our own staff back in to start preparing those meals. Part of the goal is, I want to save jobs for our staff members. And our kitchen staff, I think, prepares meals that we know that the seniors like. So it'll be menus that people are used to receiving if they come here for meals. And we're in a position now where we can source the ingredients, which at the beginning of this crisis, we do most of our shopping retail. We have lined up somebody who could do delivery of produce and things like that. So we're in a position now to be able to obtain what we need to do the meals ourselves. We've really appreciated all the help of the school system, but we really do think that, our staff does a really good job at this, and we want to kind of get back to business as usual, and providing meals for people who don't cook for themselves or have very limited support. This is what's going to allow us to continue to do this, and in an expanded fashion. So we're going to be adding Wednesdays to our meal.
Thank you.
as well.
Thank you, because I feel that the meals from the school were starting to slip. The quality was slipping.
Well, listen, it's not the food maybe that a lot of our seniors typically have. but they are cooking meals. The school system generously stepped in when we had no other resource, and they were cooking meals, not just for Orleans, but for Eastham, and other community, and Brewster and Orleans. So they were doing a lot of meals. And so this will let us kind of focus on what we know we do best.
Is this
Thank you.
meals to be given away or?
Yes. So Bob, we've been doing this honestly since March. We've been delivering 50 meals a day on Mondays and Fridays for people who really don't cook. It's a way to kind of stretch dollars, and for people who were coming here for meals. So we've been doing this right along. This gift is going to allow us to expand that. And hopefully by the time we get to this at the end, we'll be able to reopen in some fashion so that we can get back to what we do.
Are these meals delivered at home?
They are. They
Ah,
are. Yeah.
The reason I asked is that the church down at Rock Harbor has a meals for kids that they give away up at the school.
Mm-hmm.
I didn't know whether this was going to be part of that.
No, this is just for Orleans seniors. The school program has been giving out meals to, I think, kids and youth up to the age of 18. That's through a special youth, school funded program. So that's not what this is. This is
Okay, good.
And Judy, were part of the recipients those that previously relied on our transportation to go to the grocery store?
absolutely.
That's
So
what I thought.
that's part of it. I mean, we did have to close transportation down for a period of time. And the way we've resumed that, I'll talk about that in a minute, but where everything is under such strict safety protocol that having to do everything different is limiting how much we can do. So we're kind of finding what we have needed to do is approach needs from different angles in order to try and get the full depth of a need met.
Good.
Can I ask my questions now? Is it okay? There's a MOOC scholarship fund. Am I correct in remembering that's for art therapy?
The MOOC scholarship fund is for the day center, and there is nothing in that account anymore. It is gone.
And what about the
Provided
two above? I'm
wait,
sorry.
It provided scholarships for people to attend the day center, and it has a zero balance. So that won't appear on FY21.
And the two above it, Travis Smith and Anslow Trust?
Mm-hmm. So the Anslow Trust is a very small account. It's got $2,900 in it now. Travis Smith is a larger one, and we tend to use that for kind of special projects that we might do. So that might be something that we come back to if needs develop over the course of the next 6 months that we need to fund, because we're not taking revenue in right now.
And last but not least, probably because I'm not sure of how to read this, it looks to me as though salaries cost $58,000 plus for May. Is that correct for the 1 month?
Yes.
So if 51,684 is remaining for June, it looks like there's not enough. Am I wrong?
Well, it's a good catch. What we are doing, Sandy, is we're using formula grant funds this year to supplement our salary funds
Okay,
to
thanks.
a greater level than we normally do. So we will meet our payroll, but we were able to transition funds to do
Thank
that.
you.
Okay,
Very good.
everybody good with that?
Yep.
All right. Director's report. So I did give you a report, and hopefully you got a chance to see it. I thought for me, and I know I'm a little bit of a geek for data, but I was really actually amazed at how many different people we actually have served over the course of the shutdown. So even though our building hasn't been opened, we served almost 300 Orleans seniors during the shutdown. So it's not insignificant in any way. Just to let you know some of the things that we did, the Friends did a wonderful job. One of the biggest struggle, food has been the biggest struggle. And one of the things that we found is we really still have a very high percentage of older seniors who don't have access to technology. So they don't have internet or they don't have technology skills. And on top of that, a lot of the online ordering platforms for groceries really kind of got full and was very difficult to use. So we were having people having a difficult time getting groceries. So we were able to work out an arrangement with our friends of the Orleans Senior Center and Friends Market to order groceries over the phone. So people would call their grocery orders into us. We would then send all the lists together over to Friends Market. And then we accessed the Brewster Orleans Chatham Harwich CERT team. CERT stands for Certified Emergency Response Team. And they came here and they would deliver the groceries to people. So we, and the logistics of having the Friends help, because the Friends got a credit card. So what happened is they just paid for all the groceries. And then we developed a system where we put receipts in the bags and people mailed their payments to the Friends. And if we didn't have that, it just would not have allowed us to get mobile so quickly on that program. So that was a real community effort.
Did you organize that?
I'm sorry, Bob?
Did you organize that?
Yes. Yep.
Congratulations.
Yeah, thank you.
It's like a lot of work.
It truly it was, but it was a lot of work on a lot of people's part because Brian down at Friends Market, I mean, they were slammed during this crisis. So getting him, I mean, he honestly, he donated part of his business. I mean, he had people do the shopping for free for us. So I can't take all the credit. If we didn't have such a great and generous community, it would not have come together. And so really excellent.
That's wonderful.
But a couple of things I thought worth noting. Yep.
Tell me his name again. I'd like to thank him when I get there.
Brian, is it
Brian.
Jenkins or Junkins?
Brian.
Yes, yes.
Yeah, he's the owner of Friends Marketplace downtown, and he has been a gem. And his staff has been wonderful. And they have the groceries ready exactly when they're supposed to when we pick them up. It's been great. And I just thought it was worth letting people know, you know, we talk about the fact that our community has gotten older, but of all the people that we have served during this time, 44% of those people have been over the age of 80. And those are the people most at risk from COVID-19. So I think what this kind of says is we were doing what we were supposed to be doing to keep people safe. So that's interesting. And I think that the other thing that was interesting is of the people we helped, 40% also had mobility impairments. So when you kind of look at the data and why I think it's important is it really does show who we're helping. So, you know, almost half of the people we helped were over 80, half of the people we helped had mobility impairments, meaning they used walkers or wheelchairs. And that's, you know, those are the people who needed our help during this time. So I think that was helpful to see. During this time, we did suspend all use of volunteers in order to adhere to safety guidelines. We suspended our medical equipment loan policy. We just resumed that this week. We have developed a policy where we're going to accept equipment back in, give it a period of time to be untouched and sanitized before we loan it back out because our supplies got so low. And now that doctors' practices are opening up, we have been getting calls because people have joint replacement surgeries scheduled again. So we're going to get back going with that. The day center is still suspended and we'll talk about that a little bit later. Outreach has been very busy. A couple of stories I'd like to share with you. Twice over the course of the shutdown over the last 3 months, we had situations where a caregiver of somebody with dementia had been hospitalized, leaving the person with dementia home alone. And it really became crisis situations. In one of those situations, the person ended up being home actually alone for a couple of days before we found out. In the other situation, we found out as it was happening in real time. In both situations, with the help of our friends, we were able to send in emergency meals. We worked with the Alzheimer's Family Support Center, tried to get plans in place, coordinated information and communication with family members. In one case, a family member had to drive up from down south. That was some critical outreach that we did. In another situation, we had somebody who had to move into supported subsidized housing. Their name came up and you got to go when your name comes up. So we were able to help facilitate that move. And we actually found that we were able to do more remotely than we thought we could. The porch has become an important part. So strangely enough, an important part of the design, because it's given us a place to go meet with people outside at a distance when we needed to either give them paperwork or obtain paperwork and then take pictures. So we would use a table and have somebody put something down on the table, take a picture of it with the iPad, step back, you know, and do that. So it's, we've been able to really move things along. Let's see. One of the biggest things I think that we did that has been most well received during the crisis is that we filmed our fitness instructors and got them on cable, local cable channel 18. Our fitness classes are probably one of the most popular things that we do for the community. We feel that it's important in terms of health and wellness. We get lots of grumpy calls when the classes get bumped for public meetings, but we have no control over that. The town has to still comply with open meeting law. I am working on a plan with other communities. We're looking at communicating with Lower Cape TV to see if maybe we could get a senior block of hours there that wouldn't be interrupted because they have 2 different channels. So that's still underway. But the other reason that cable TV is important is that we don't want to leave people behind. We don't want to widen the technology gap. We do understand that a lot of people don't use computers or don't have internet. And we want to make sure that we don't do everything online and just really widen that technology gap for people. Transportation. So what we are doing now, we are adhering to very strict guidelines. We have had communications with the Regional Transit Authority and the State Department of Transportation. Right now, the guideline is 1 person on the vehicle at a time. I do anticipate that changing to 2 at some point over the summer because we can maintain social distance on the bus if we have 2 people. But right now it's 1. So it is not the most efficient system. However, it gets people where they need to go. Over these last 3 months, we have done a lot of work really kind of working with people to let them know that this really is for people who don't have other options, who don't have family, who don't have somebody else to drive. And we really do have, I think it's 29. We have 29 seniors who really don't have other resources for transportation. So that's what we're down to right now. So we are putting 1 person on the bus at a time. We drop them off for shopping. We have to sanitize all the touch points of the bus when the person gets off before we can put another person on. So our schedule looks very different, and our bus drivers have become 50% custodians because they're spending a lot of time cleaning. But that's because I will say the driver team has been amazing at wanting to continue to help people. So that has been really helpful. What we're finding right now in the last week is that doctor practices are opening up and starting to take appointments. So because we cannot have the FISH volunteer ride program, we're going to have to look at what we can modify with our buses. You know, it's not going to be efficient, but we do have to get people where they need to go. We're going to be triaging those kinds of calls through outreach so that if somebody, for instance, has mass health, they can get referred for what's called a PT1 ride, and the health insurance pays for it, and we don't have to provide that ride. We really are trying to really ferret out all the stuff that someone else can do and just do the stuff that nobody else can do. So we're doing that.
There's volunteers?
Excuse me, Bob?
Are there volunteers that would help people?
We can't use volunteers right now, Bob. We can't use volunteers because of the governor's orders. So we can't use volunteers, and we can't let clients get in volunteers' cars because there's no social distance. So the FISH program right now is suspended. We'll look at it again in the fall in light of what new orders might be.
Yeah.
Truthfully, councils on aging have been very frustrated. Elder Affairs and the governor, I mean, you know, COVID is put older adults most at risk. And they have not put senior centers on the governor's plan. So we're not sure whether they haven't done that because they don't want it on the plan at all, or, and we have been really fighting for clearer language and haven't received it. And so right now there are regional and state plans through the Council on Aging associations that we're working under with what is going to be allowed when. But obviously we're going to be the last things that come back online. And those big group activities like fitness classes with 45 people, that's not going to happen here for a long time. So we are going to have to think when we are allowed to do small group activities, we're having to learn how to do things in new ways. It's not going to go back to business as usual. It's going to be new, it's going to be all new. And we're starting to kind of think and vision about all of that now.
I'm a participant in Sit Fitness on the TV.
Yeah.
It's great.
The one thing that we know that has happened, and we know because of the phone calls we get, is that I think we may have more people participating in fitness. And I'm hopeful that some of the yoga has picked up some people, because we have one of our newer yoga instructors, Deborah Gerard, is on TV, and she does a really beautiful Janta yoga class. So it's even if you didn't come here, maybe you're participating in the class. I talked about the meals.
Judy,
Yes,
is, is there any way we can help? You talked about getting us on to different television stations. Is there anything we can do, calling or impressing them with the value to us individually?
Well, I know that a lot of seniors called the town administrator's office. And I don't know if MEF knows anything about that. You're muted, MEF.
I'm sorry, can you repeat the question?
So MEF, Sandy was asking if there's anything the town can do about having the fitness classes not be interrupted. And I said, I know that a lot of people had called the town administrator's office. My understanding right now is that the problem is that channel 18 has to be used for public meetings to comply with open meeting law.
And I got sort of aware, I was made aware of this, I think more back at the beginning. And there was a week or two where the class was bumped for, I think, the planning board. So when I asked about it, John Kelly said that had all been figured out. So that's clearly not the case.
I don't think so. I mean,
No, I think they've been okay now. We haven't had any calls lately.
Yeah. Sarah was really good about getting a banner up so that if she would play it later, she would post on the TV when the class would play again. But we still are looking at the possibility of using Lower Cape TV and doing it collaboratively with the councils on aging from Eastham, Brewster, Wellfleet, and Truro, which are the communities that comprise Lower Cape TV. And that way, everybody would have access to programming from all COAs, and it would be a block of time that wouldn't be interrupted. So we're looking at that.
Judy, what kind of obstacles are there to that?
Well, they already have a programming lineup is one of the obstacles. For me personally, I don't want to have to be in charge of it. We'll bring a lot of content, but I don't want to carry the other communities. I'm only interested in doing it if our seniors get something out of it, because I know other community seniors will get something out of the content that we bring to the table. So I've had a meeting with the other Council on Aging directors. We're kind of moving into stage 2 to see about what it would take, because a regional collaboration only works if everybody brings something to it. And that's what we're working on right now, is if everybody is in a position to bring something to it.
It sounds like a fantastic idea.
Judy, do you have comfortable access to Sarah Eaton? I mean, is she someone that's available to you?
She's been wonderful. Truthfully,
Yes,
she's been really good to the Council on Aging. She helped us do our initial filming of the fitness instructors, and then Donna and I got so good we were using my iPhone to do it, and then my teenage son helped us download it all. So we've been very creative about how we got things done. But Sarah has been very good.
That's where I would start with
Yep.
with your idea.
Yep.
And see what she has to say.
So she is Channel 18, but Lower Cape TV is a different organization. They're actually located in the buildings at Nauset High School. And they have two different channels. They have an educational channel and a public channel, and they don't really do, they show public meetings, but usually not in live time. So there's a little bit more flexibility for us using that channel, and everybody in those 5 communities get channels 22 and 29 or 59. I don't remember.
19 and 22.
So, yeah, okay.
19, 22.
David,
I'd like to interrupt just for a second.
wait a sec. David's trying to talk. You're muted, David.
Can you hear me?
Yep.
Yes.
I know the fitness program was a source of income for us, which we don't have at the moment.
Mhm.
Can we put some kind of plug in when they do the fitness on the TV channel or wherever it is, that we certainly accept donations at whatever, and that this is the address to send a donation in or whatever, because at the moment, it would be a free service and be nice to have some donations from it.
So so I'll address that a couple of ways. Right now, we just wanted to get something out there. We actually did pay the fitness instructors from our program funds for the filming, just so you know. They didn't do it for free, although one person did donate her time. We still have outstanding fitness punch cards. So in the next week or two, we're going to be sending letters to those people asking if they want to get reimbursed. They need to send their card in. Otherwise, if they don't want to get reimbursed for what outstanding fitness classes they had paid for, if they'd like to donate it back, we'll keep it and use it to pay for these programs. And I think down the road, I mean, I think we've done a pretty good job with our with revenue, and we're pretty thrifty, I think, in how we do things. We have enough money right now. And I think that at some point, our Friends has been very generous. We do have other funds. And I'm right now, I've decided we're not going to worry about that, but we may need to down the road.
Okay.
Thank you. Just a point of information. I would like to congratulate Meth on winning the election for his seat.
Bravo.
Congratulations, Meth.
Congratulations, Meth.
Well, thank you. And it's nice to be sharing a computer screen with you all this afternoon.
Oh, good.
And
Good to
we'll
have
be-
you here.
yeah.
A
Okay.
new way of life.
Yeah, well, I mean, it's been going on for so long now that it isn't new.
Yeah. It's new for us, our board. This is our first time. So.
Oh, okay.
All right, so I've talked a little bit about the meals. I think everybody understands that. We've talked about fitness. LGBT, our Lower Cape LGBT seniors group is something that did fall apart. To be honest, we triaged this program very carefully. Cape Cod Pride in the last 6 months has developed a very robust online offering of small groups. We felt like there were options there for that group. That being said, we are going back in July. We have a program. It's going to have a facilitated discussion, and we have masks from the Human Rights Commission as giveaways for the first 20 people who sign up that we'll mail to them. So we are working on that. In terms of health and wellness, we are working through our Pathways to Better Health or Healthy Aging program. We have a program coming up on that online this summer. The newsletter just went to the printer yesterday after an incredibly frustrating 24 hours of computer problems. But we have staff doing the labeling on Friday. We hope to get it in the mail on Monday morning. We took a few pages out. We didn't feel like we needed calendar pages and such. We tried to donate some space in the newsletter to answering the questions we get most often on the telephone. And we think it's a good effort at trying to get back into letting people know what we're doing. The big news is today we were able to get permission to get the tax aid program from ARP back in here under very, very strict safety protocols. So some communities didn't allow it, but we were able, this program had to be approved by the state ARP Foundation, the National ARP Foundation, the health department here in Orleans, and the town administrator. So we wrote very specific, very strict safety guidelines. So the 2 volunteers are here sitting miles apart doing taxes. People are not in the building. They just had to show their ID. We have a no contact table for paperwork. It's really allowing them to file taxes for about 35 people who had their appointments canceled. So the building is still not open to the public. We are just doing this one program because we are under that July 15th deadline, and we're very thankful to the 2 volunteers who for ARP are making that happen.
Judy,
Yeah,
you're going so fast, but
I'm sorry.
under health and wellness,
Yes,
this Tara Hart,
yes.
is she possibly going to reorganize the meetings for neuropathy?
Oh, that's a good question. I'm not sure. I'll ask her that. A lot of the medical practices laid off staff, if you don't know that. A lot of the
I know.
A lot of the
Yes,
Cape
that's
Cod
why I'm
healthcare
asking.
staff, was laid off. So I'm not sure what Tara's status is right now, but I do know that we are planning. We know that a lot of them are opening, and she's been a real resource for us in terms of programming. And I'll look into that.
Because we had the program stopped, and I think originally we had quite a few people attending those meetings.
Okay, I'll ask about that, Keith, and I will let you know. Okay.
Thank you.
Okay, and that pretty much wraps up. I think the one other programming thing I want to let you know about is that this year was supposed to be how the Housing Assistance Corporation has this wonderful program called the Big Fix. And every year in early fall, the end of September, early October, they host this program in one community on the Cape. And they get hundreds of volunteers to go do fix-up projects at people's homes. It's really for low-income seniors, veterans, and disabled people. October 3rd, I believe it is the Big Fix in Orleans. Now, unfortunately, we've just lost 3 months of the organization, and we're going to be challenged. We're not going to be able to do inside projects, but we are still going to move forward at trying to do some work. So there's something in the newsletter about it. We have had meetings with Town Hall. The Housing Assistance Corporation has met with the DPW director and John Kelly in terms of, brush disposal and all of that kind of thing. So if in your walks of life, you know somebody who might need help, if you could ask them to reach out to Lynn Brine, our social service coordinator, we're going to be doing kind of the preliminary help getting people to do the application, and we're going to handle as much as we can over the telephone. So you'll see information in the newsletter about that. That's something we don't want to lose, that opportunity to help people who really could use some help. And we have identified a couple of individuals already. But typically it's like 10 to 15 homes that receive assistance through this program. So whether it's a wheelchair ramp or bushes that need to be cut or yard work or, repair on steps or something like that. If you know of anybody, be in touch with us, please. We want everybody to help spread the word on that. So that, I think, is my report.
One more thing. Judy,
Yes.
either I wasn't listening or you forgot to talk about Sue leaving.
Thank you. I did forget, and I apologize about that. Sue Bile is our outreach worker. She is retiring on July 24th after 20 years of service to the town. Sue, we are planning a drive-by porch goodbye in July on the 23rd for her, and that'll be in the newsletter. You'll see that as well. We are advocating for that position to get filled. We have really, through this crisis, identified what our essential positions are. We feel that outreach is essential. We don't want, if there is going to be a hiring freeze, we will advocate that this be an exception to that, because we really, we need a full complement in our outreach team in order to do what we do. And so thank you, Sandy, for the reminder.
Okay, next section is a selectman liaison. We have the real thing here. Congratulations. Did you have anything you want to say or?
No, I'm, thank you for your kind words, and I'm glad to be here, and I'm glad that the campaign is over. Um, and actually, I do want to say from not just from this meeting, but from other things, I said what an awesome job you've got the council's been doing here. I mean, really is amazing.
Thank you, Matt.
Thank you. Okay, report of friends of COA. I don't think we have a representative here, but I did want to go onto the record to the information that Judy told us about and how supportive and what a great job they've done in helping us through this area. I just want to make sure they were recognized in the program, and a big thank you and for funding, logistic support, and help with the food program. All right, we're going to move on to new business. And that's going to be that.
At our last meeting, so at this meeting, we should have been voting on our transportation policy. But what became clear to me over this last 3 months is that there's something really important missing from the transportation policy that needs to be added in there. And so before you vote on it, so we can't vote on it today, but if you accept this language, we'll add it in and vote on the policy next time. The issue really is that the policy gets thrown out the window in times of emergency, and there needs to be language in our transportation policy that allows for that. We don't want people saying, well, your policy says, because during periods of emergency, that doesn't apply. So I sent you some language. I'm just going to read it so that it goes on the record. Transportation policy during periods of emergency. The Orleans Council on Aging operates a municipal transportation service for residents of Orleans only. Transportation is considered an essential service, and during periods of emergency, the COA director will have the authority to modify the existing transportation policy to protect the safety of riders and drivers. Consideration will be made to adhere to safety guidelines established for the emergency, whether it be a weather emergency, natural disaster, public health crisis, etc.
Very good, Judy.
So if we need to have a consensus that can be added into the policy.
Right.
And that's added to the policy.
Yeah, I will find the right place to put that in. It'll probably go after other transportation resources. There'll probably be a section called policy, emergency transportation or something like that. So if you're all okay with that, I'll add that.
That sounds important enough that it should be right at the top. It's sort of like an introduction to the rest of the 2 pages.
Yeah, we could put it after eligibility. What do you all think?
Do you think that there should be a statement in there which gives you the power to amend this based on the person's individual emergency needs?
Well, let's see, I feel like because it says the COA director will have the authority to modify the policy.
Oh, that may do it.
That I feel like that covers it, but if you feel differently, I don't feel invested in the language other than it needs to say that I have the authority to make the change.
Yes.
No. Okay.
I make a motion.
Okay, it's just right now it's consensus because next time we'll vote on it.
We'll vote on it.
We're just tweaking the draft, okay? So that'll go into the next meeting that we have, which will be on July 22nd. You're going to vote on that. So I'll get the full policy out in the packet and we'll vote right on it. And we have to vote as we're expecting it to be. Anita, you're muted, Anita.
You're muted.
Okay. Can you hear me now?
Yes.
Yeah.
Okay. In terms of the order, I'd go for first the policy and then the exceptions at the
Okay.
end. That's just my preference.
Okay. All right. Maybe we'll just bold the exception so it
Mhm.
stands out.
That'd be good.
All right. All right. Got it. Thank you, Anita. Okay, Bob, is it okay if I move on?
Yes, is this a vote?
It is going to be a vote. I want to talk about it first because I want to answer any questions that anybody has. And I'd like to talk about what a laborious process really this whole thing has been. So let's just talk about the day center for a moment. So we have 30 plus families that participate in the day center. Of the people that we serve, probably 95% of them have cognitive impairment, dementia, or Alzheimer's disease. Okay. So what we do know about the COVID crisis is that we do know that COVID is spread greater through group activities. We do know that older people are most at risk. And we do know that people with health, with chronic health conditions have greater risk. There's been a lot written even recently about the neurological impact of COVID on people with dementia. So we know that there are some special risks now, although we don't know the full extent of them. So there are 5 supportive day programs on the Cape. And we did some talking. I have been participating in meetings statewide about supportive day programs. We have had the Executive Office of Elder Affairs sit in on those meetings at times as well. At this point, every supportive day program across the state is suspended, including ours here in New Orleans. But what the issue really is looking at, there is no language in the governor's reopening plans for supportive day programs. There is language for adult day health programs, but there's a big distinction between adult day health and supportive daycare. Adult day health care is a medical model. It is supervised by nurses and certified therapists, like occupational therapists. Supportive day is a social model. It's not a supportive model. Our model really is for providing respite care for caregivers primarily, but also for providing forms of engagement and enrichment for people who have mild cognitive impairment in order to, maintain skills and help them stay engaged. Not having this program has been an incredible loss to the caregivers that we serve. And we have to acknowledge that right now there is an unmet need. The Alzheimer's Family Support Center on Cape Cod has been absolutely amazing at stepping up to this community of caregivers. They are sending out daily emails. They always provide information on things that are free. They do online support groups now. And there are lots of options there. They're not the same. I mean, we have to acknowledge that just like this meeting, it's not the same. It's not the same as, being able to get out of the house and go to the hairdresser or have lunch with your friends for a caregiver. This is a true loss and it is providing hardship. On the other hand, it is really challenging to imagine how we will be able to hold this program and adhere to the required safety protocols that will be in place. So the required safety protocols will be that everybody, staff and participants, will have to wear masks. They will have to maintain a social distance of 6 feet, even at times of meals. If we're providing meals, we would have to maintain social distance. So the language here, we got together, the Councils on Aging on the Cape, and we just, I really think truthfully at this point in time, as hard as this is, as disappointing as this will be for the caregivers, I feel that it is impossible under these circumstances for us to be able to adhere to the safety guidelines where we're serving people with cognitive impairment. I just don't think that we would have 100% success with face coverings. I don't think we do a lot of help during transitions with, arm to arm guidance. It's not just verbal cueing. Limiting group size will certainly drive the cost of the program up, although that truthfully is not a primary concern for me right now. But it is the whole ability to adhere to CDC safety guidelines that I feel would be really challenging. And not being a medical model, we also will be challenged to limit exposure. I mean, they'll probably be wearing gowns. We don't have that. And I don't think our clients would receive that really well. I'd like to think that maybe as we move forward in the fall, if the health trends continue to be positive, maybe we could look at more of a respite model than a supportive day model. But right now, it is with great regret that I have to recommend that we really have a formal hiatus from the program. I just don't feel that we can safely bring people back in the program and provide the services in a way that adheres to the guidelines because of the nature of the people that we serve. I feel awful about this. Our staff feels awful about this. Our staff has been tremendous at supporting the families. We have day center staff has been sending notes and letters almost weekly to different families. Anne, the director, has been making phone calls to day center families on a regular basis. We have sent them a DVD of the Sit Fitness program so that everybody could participate at home. That was the class they did when they were here. We did care packages with puzzle books and coloring pages and stories, and we've remembered people's birthdays, and we're doing everything that we can. But we have to recognize that that's while it's supportive and we can still find a way to continue that level of support, being able to have people back in here for supportive daycare is very unlikely, at least until 2021. And so for that reason, I'm recommending that we formally suspend the program through December and revisit this at the beginning of 2021. Anita, you're muted, Anita. There you go.
Okay. Is it possible to have some kind of scholarship respite so families with this need could have someone, a home health aide, come in so that they could have a little break once on an emergency basis or something like that?
So we definitely could do that. And I think our friends would be very receptive, at least Orleans seniors, in doing something like that. But here's the thing, we have also suspended the private pay referrals right now because we don't have any way, although we query people, we don't know what people are doing for testing. We don't know what homes they're going into and out of. We don't know what safety precautions individuals take. So for liability reasons, we have also suspended our private pay referrals. Most of the home health agencies on the Cape are still operating, although in limited capacity. What they have found at Elder Services is that the people who have home cares and personal care aides, their service levels have been decreased significantly because people have elected not to have people coming into their home that are going to other homes because they've wanted to minimize their risk. Now, I did talk about this, Anita, actually with Molly Perdue of the Alzheimer's Family Support Center, and I really do think our friends group would be receptive to this. Home health agencies generally have 3-hour minimums, and right now, a 5-month waiting period to find somebody to go into a home. So that's the reality that we're dealing with. In addition to that, we just got word unofficial, although we expect that it will be made official in the next week, that the VNA is also now pulling out their private pay care out of all of the remaining towns on the Cape, so that they are going to transition to only doing certified hospital discharge services and hospice. And that's going to happen, I believe, in August. So there's now another loss of a provider on the Cape. So that's, that's a bigger issue that we're really going to have to start working on collectively and regionally with other partners in the aging field. And we met actually yesterday afternoon, the Council on Aging Directors, and we're going to be asking somebody from the VNA and Cape Cod Healthcare to sit in on a future meeting because we're concerned about this trend. And really worried about the waiting time for people to get the services that they need and the options for, to have people. So I think approaching the friends is a very reasonable thing to do. I honestly think they'd be super receptive to that. And listen, I have I don't feel good about saying this, but I will tell you that the Yarmouth Council on Aging has laid off part-time workers. The Bourne Council on Aging laid off all of their daycare staff. The Eastham Council on Aging also has laid off their supportive daycare staff, and it's happening statewide. So I've waited really as long as I can to try and wait and see if this is something that might, bounce back quicker than I hope it will. But I honestly don't think that we can safely do this program. And I don't want that on my conscience. I don't want to have people come back in here and too soon. And we had holes, which we know we will have in the, safety, adherence to safety guidelines, and have something happen. Because it won't be willful or, capricious non-adherence to the guidelines. It's an inability to really kind of follow them. And that's what's almost harder. It's really challenging. And so this is, I'm bringing this to you honestly, I'm bringing this to you sadly, but I really feel that we need to let the families know. Right now, we're kind of in this whole holding pattern, and it's hard for them to plan and make decisions. And I don't think that's fair to them either. I am not suggesting that we eliminate the program. I really feel strongly that we need to maintain some kind of a formal outreach so that we can start back up as soon as we are safely able to do so. But I do think that there's going to be a very precarious time from everything we're hearing from public health and Barnstable County Human Services, that the fall is going to tell us whether, we will have another wave or not. And so we can't be starting something during a period of uncertainty again. So I think that we need to suspend this program through December. And I think that my recommendation is that in January, we formally reevaluate our ability to resume the program.
Yes.
I assume that you've had conversations with Jeff Deering and Chief McDonald about this, because I think there might be a consequence for their operations as well if more of the Alzheimer's patients are left on their own at home. I'm not sure what they can do about it. There is that reassurance program that theoretically might be expandable, but they should know if that's going to be happening here.
I have, truthfully, Meth, I have not had conversations with either of them. My conversations have been with staff, with aging professionals, with the Alzheimer's professionals on the Cape, with health professionals, with COA colleagues, and I have had conversations with both the town administrator and assistant town administrator. The recommendation was that I bring this to the board. This is a policy decision, and then we move forward. None of the people that we serve in the day center, I shouldn't say that because I know we do have two. We have two people who live alone but have family members live next door. But other than that, everybody is living with their care partner. So this isn't going to leave anybody alone. That being said, this has been, we've all been impacted this in one way or another, but for caregivers, these are really long days. I mean, they just are really incredibly long days.
But it's funny because the same thing can be said for the parents of the kids.
Yeah.
Their days have been really long since March too.
Except, look, Beth, you can bring a child outside to play. And
yes,
that's a big difference. I mean, when you're dealing with somebody with cognitive impairment, their ability to understand what's going on. And that's the whole concept around the challenges with the masks. I mean, you can't have a young child wear a mask, and you're not going to be able, and a 4-year-old child, you're in a daycare situation, you're not going to be able to keep them away from the other children. And that's somewhat similar to what we're dealing with. But the ability to comprehend, the seriousness of it all. And the other thing is that the health impact for the population we serve is gravely different than it is for children.
And I agree, but I think for the caregivers,
Yes.
it's somewhat comparable because their lives have been totally turned upside down.
Right. Yep. Very true.
Does this exclude the call in to the police department every morning for people that sign up who have needs?
What do you mean, Bob? Does it exclude that? The police department, you can still sign up for that. So my guess is that a lot of these people aren't on that because most of the people on the telephone reassurance are people who live alone.
Yes. Yeah.
So one of the things that we are working with and will continue to work with this group of caregivers also is what became acutely important during this time is that caregivers need to have plans, emergency plans. And it's not helpful to be working on it when the emergency happens. It's real. So that's one of the things we are working with the Alzheimer's Family Support Center on, because in the two situations that we dealt with over the last couple of months, there weren't emergency plans in place, and it just was really challenging to manage.
What is it you need from the board?
A vote.
A vote. Well,
So we have a vote here. We have a motion to approve suspension of the daycare center.
Given that we have no,
virus.
it seems as though we have no alternative.
Yeah, it's a sad vote, but I think you're right.
You do. Let me address that. We don't have to do this. I mean, we can continue to go month to month. But my recommendation is to set a time frame on this because to allow families to plan, and because it just feels like this real period of everybody not knowing, and we get calls like, when are we coming back? When are we coming back? And it feels like, that's not kind either. Just like to use Mef's analogy, parents want to know, is there going to be school in September? And the decision is going to be made by a certain date. I feel that we're at a point where we need to make a decision. Now, if you want to shorten that time frame up and you want to say the program will be suspended until you pick the date, this is your vote. I'm just giving you my recommendation.
No, you have a much better handle on it than any of us have. I think if this is the date that you're comfortable with, and I think it's not popular, but it's the right thing to do. So we're going to put it to a vote unless there's other comments, put it to a vote to approve suspension. All those in favor, aye.
Wait,
Can I clarify?
Wait 1 second. Yeah. Before you vote, please, Bob, you need to have a time frame in the statement, and Donna needs to be clear about who made the motion and seconded it.
Oh, okay.
I'll make the motion. Time frame is till January 1st,
Okay.
I believe.
Yep. Okay. And the second,
Second,
Anita.
David and Anita, okay.
Okay. And then could you raise your hands for the vote when Bob asks for the vote, please, so Donna can see it?
Vote to approve this. Yes.
Raise your hands. Everybody?
Yeah. So that's unanimous, Donna.
Okay, thank you. Thank you.
Thank you very much, everybody.
Thank you.
It's got to be very difficult for you to have to do that.
It's really hard. I mean, it's really hard. I was on a meeting yesterday and I had a colleague in tears because it was a council on aging director who had worked in this a supported day program for 14 years and just had to lay all her staff off. So yeah, these are hard times. Moving on, I want to talk a little bit about the review of board member terms. So the only one with, Bob, are you okay if we move on?
Oh, yes, fine.
Okay, sorry about that.
Could I interrupt for a second? I have a medical appointment in Sandwich at 3 o'clock, so I may have to leave before this meeting is over.
Okay, thank you, Bob. When we see you go, we'll know why.
Okay.
So the only one who has a term, actually two people have terms, no, only one person has a term expiring this year, and it's Keith Campbell. And Keith, you want to talk because I believe you were contacted by somebody at the town administrator's office.
Yes.
You want to tell everybody where you're at?
Well, I returned her phone call and said, it left a message on her answering machine that I would accept another term. God willing.
God willing, it's right. I just feel like through right now with all of the turmoil and change that we're going through, for me personally, and for us as an organization, maintaining the same group of people will be helpful. So I'm pleased to hear that you're willing to stay on.
Well, you and I did discuss it before I called her.
Yeah, I did a little nudge. Okay, and then Bob, election of officers, I'll let you handle that.
Okay, I would like to place in nomination for the position of vice chair, Anita Rogers. And I've worked with her on a few projects in the past, and I've been very impressed, and she's shown her abilities here. So I'd like to nominate her for the position of vice chair. I need a vote on this as well. All those in favor?
You gotta have someone second it.
Second, I second.
Second.
Keith Campbell.
That's it.
And now you vote.
Put your hands up, please.
Hands up.
Anita, are you abstaining?
You're gonna vote for yourself. That's
No, you
good.
should vote.
Thank you.
Great. Congratulations.
All right, so you need to also, somebody needs to, if we need the chair nominated for the following year. So
Already?
I nominate Bob.
No. whoa, 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 whoa.
And I second.
Oh, for the following year, yeah. My
Yeah.
term's up in a year, that's okay.
A vote, please.
Aye.
Aye. Harry's up. Bob, you voting? Thank you.
Yes.
did you vote, Sandy? Sandy's froze. I think we're having trouble. She's on the Portage Senior Center, and I think we're having some internet problems.
Yeah, she's having some
Sandy, did you vote on that?
Yeah, I'm sorry. I had my hand out of the screen.
Okay.
So,
Yeah, she's freezing up, Judy.
Yeah, there's nothing I can do.
Looks like you're frozen. Oh, you were just frozen a minute ago too.
Yeah, we've had bad internet today. All right. Anything else, Bob?
No, that's it. I had nothing under old business. And I think I would ask for a vote to adjourn the meeting.
I vote.
Question, was anything ever done about the survey?
About the what?
The survey you were working
Yeah.
on?
Oh,
Keith, thank you. Gosh, good. Thank you for bringing that up. So here's the thing. So we were supposed to vote on that today because it was supposed to get into the newsletter. We actually were supposed to vote on it in March. But the problem is this is not the right time to put this in the newsletter.
Okay.
I still think we can do it this fall. So we're going to talk about it at the next meeting, the final version of it. I'll bring it back to you. That you had already created. So you had done that in February. So we'll bring it for a vote in July. And then maybe the September, October newsletter, we can get it out in that one. Okay?
I'm not sure that makes sense.
Yeah, I don't know. Right now, because I don't know what it would be somewhat cruel to be asking for program suggestions at a period of time when you can't
You can't have a program.
So I think we need to wait and see what's going to happen.
Can
But
we
if you approve it and get it ready to go, then we can have it ready to go as soon as we.
Okay, I agree.
Thank you for reminding me, Keith, about that.
I move we adjourn.
I second it.
Who seconded
Yes.
that? Anita,
Mhm.
was that you? Was it Deborah?
Yes.
Thank you.
Yes.
All right.
All right. Thank you all very much for being here today. And if you do have questions, you have anything you want added to the agenda, talk to Bob before, in the next couple of weeks for our next meeting agenda. And if you have any questions about what we're doing here, you know where I am. Give us a call.
Doing
All
a
right.
great
Good job.
job. Doing a
Thank
great
you.
job.
Thanks,
Judy, thank
everybody.
you.
Very good to
Bye-bye.
see you all. Stay
Good to see
healthy.
Everybody.
Good to see you too.
Good to
Miss
see
everybody.
you all.
We miss you all.